I agree, right? I think national insurance is just a con. It's a trick that politicians use to make it look like we're not paying as much tax on our income as we actually are.
Oh, there is absolutely no basis for legislation that we should be banning a product for everyone because people that are already banned from buying it are somehow managing to get their hands on it.
One of the failure modes of left-wing politics or centre-left politics is this belief that just if people participated more, if we could have a bit more participatory democracy, well, everything would be fine.
Welcome back to the Institute of Economic Affairs podcast with me, Reem Ibrahim, the IEA's Acting Director of Communications. Today I'm joined by the IEA's Executive Director, Clougherty, and the IEA's Managing Editor, Daniel Freeman. We bring you a current affairs podcast with a difference. We want to go beyond the headlines and instead focus on the big ideas and foundational principles that matter to classical liberals. Today, we're going to be discussing the National Health Service consultation, the disposable vapes ban, but first, let's do some mandatory pre-budget speculation. Tom?
More pre-budget speculation. This seems to be one of the most pre-budget or the most speculated about budgets I can remember. I mean, I guess perhaps that's natural. It's a new government with a big majority and a change perhaps of emphasis and direction on tax and spending. I think probably next week this podcast will be an all-budget, wall-to-wall special. For now, let's just focus on a couple of things which seem to have come into slightly sharper relief this week. Now, there's endless speculation, as I say, about every aspect of capital gains tax, every aspect of inheritance tax, and much more besides. Honestly, I don't know what we're getting on those fronts. I'm not sure many people outside number 11 do either. But the two things that seem pretty nailed on at this point are, first, that the government is going to add national insurance contributions to employer pension contributions. The second thing, and this has been pretty much confirmed by Rachel Reeves in the Financial Times, is that the government will change its fiscal rules. It will adopt a broader definition of public debt. Effectively, they'll start counting things like student loans, government equity stakes in businesses, and funded pension schemes as assets against their liabilities. So, a couple of things to say there. On the NI on employer pension contributions thing, obviously there are two dangers. One is that it reduces the amount that people save for their retirement because employers are discouraged from making those contributions. Or if they're already basically at the level of pension contributions that is mandated by law, you might expect to see those increased taxes passed on into lower wages. So actually, there is a great deal of potential variance in how much revenue this measure is going to raise. And we have some research at the IEA coming out with Policy Engine soon, which will give a sense of how big that range might be. So watch this space for that. What's interesting, though, is that this week it's pretty much been confirmed, I think, in the Times newspaper, that the government will reimburse public sector employers for the additional cost of this measure. Now, that's actually not hugely surprising because, after all, it is the public sector which largely makes huge employer pension contributions. And where those schemes are actually funded rather than just fictitious, so like in local government, for example, had they actually had to pay the full 13.8% on the massive pension contributions they are making on behalf of their employees, probably even more of them would have gone bust than are going bust already. But on the other hand, surely this shows that this is not a cost-free measure, that the government is just picking up easy money. It's not like the public sector is the only part of the world which is resource-constrained. It's going to have exactly the same kind of impact on private sector employers as it will in the public sector. And the government isn't compensating them, far from it. I mean, they're the ones coughing up the money. So I think it exposes this fiction of a cost-free tax increase that the government just thinks they can get away with. As I've said before, there is actually a case, if it's coming in the context of you're cutting other taxes and you're balancing it out with some tax increases, it is a little bit weird that employer pension contributions aren't subject to any tax at all at any point in the process. Arguably that distorts markets so that employers are more likely or they're going to prefer compensating people through pension contributions rather than through salaries. I think you can argue that should just be a more neutral market-based choice. Or, of course, you could say we want to encourage employers to make the pension contributions to make people more comfortable in retirement. You can argue that one both ways. What I want to say about the shift from public sector net debt to public sector net financial liabilities is, yes, these are kind of assets that they're setting against the investments that they're making, the debt they're taking on. On the other hand, they lose a lot of money on the student loan book. The government really shouldn't be taking equity stakes in private companies. Normally when it does, it's because they've run into trouble and are not going concerns, and they need a government bailout. Thirdly, funded pension schemes. Interesting emphasis there on the funded pension schemes. Now, sure, those are assets. It doesn't sound like we're going to start taking account of all of the unfunded pension liabilities that the government has accrued and is continuing to accrue. Not to mention all of the other off-balance sheet liabilities that exist, whether it's paying for people's old age health care, or social care, or nuclear decommissioning, or public-private partnership, PFI contracts, etc., etc. This does seem a little bit of the government just picking the bits it wants on the balance sheet so that it can borrow more money, and ignoring a lot of the things that make the fiscal situation look worse than perhaps they're willing to admit.
It's really, really interesting stuff, I think, in that pre-budget speculation. I think especially on the removal of the exemption on employee pension contributions. Is there any sense that this will have an impact on, those kind of consequences, that this will have an impact on wages or indeed on other kind of benefits that employers do accrue with them?
Yeah, I mean, I think that there are the two important things to bear in mind here. And actually, I think that this story illustrates them quite neatly, or perhaps when we look back at it with the benefit of hindsight, it will illustrate them quite neatly. The first one, it's always important to remember that the incidence of a tax doesn't necessarily fall on the person who actually pays it. Most of the time when we tax businesses, the cost of that tax is passed on to someone else. Now, it could be shareholders, it could be customers, but most often it's employees. And almost certainly when you raise employers' national insurance contributions, it passes through into wages, given a little bit of time. It may not go wholly into wages, it may not be instantaneous, and it may not be that anyone actually sees their wages fall as a result.
They just don't increase as much.
They don't increase by as much, or you don't create as many jobs, or of course you cut back on other benefits as a result. That is almost certainly going to happen here, and it's a good lesson to bear in mind for the future.
I was going to also add that they also could just hire less people, right? I mean, that also has an impact on the supply of work as well. Daniel, what do you make of the pre-budget speculation?
I mean, a lot of it is a product of constraints that Labour have imposed on itself in the election. So they, in the election, they promised not to increase taxes on working people, whatever their definition of that is. They promised not to increase VAT. They promised not to increase income tax. They promised not to put up national insurance contributions. And it's a bit unclear about whether putting employer contributions up breaks that manifesto promise. Now, either way, as Tom's pointed out, it doesn't really matter. Whichever bank account this is coming out of, it is still a tax on labour. It's still a tax on wages. And so that ultimately is going to be paid in part by workers.
Yeah, I think it's really interesting just on that point about the instance of tax in itself. In Chapter 6 of the Introduction to Taxation, one of our latest primers published here at the IEA by Eamon Butler, it goes into this in a lot more detail, just the principles of it. But this applies to so many other taxes, doesn't it? Sales taxes or anything like that, it's often consumers that are paying.
Yeah, stamp duty, for example, one of the most pernicious taxes in the system. The incidence is not entirely on the person buying the property. That's why, for example, it affects decisions to downsize as well. The incidence tends to be split between the buyer and the seller. Corporation tax, for example, the best and most comprehensive studies of this tend to show that if you put up corporation tax, about 50% of the burden is borne by workers in the form of lower wages. I realised, by the way, when I answered the last question, I said there are two lessons you can learn here, and I only gave you one. The other one is very simple. It's that taxes affect behaviour. And in a sense, these are two sides of the same coin. Unless you design a tax change extraordinarily carefully, and even then it might be just about impossible, taxes are going to have an impact on economic decision making. And that can mean that the burden of a tax, its impact, is quite different from what people expect and what policymakers might want to happen. This is all much more difficult than they tend to imagine. And that's doubly the case when you're talking about taxes on investment, like capital gains tax, for example. Still rumours that something is going to happen on that. We'll talk about it next week, knowing what's happened rather than just speculating. But you have to be extremely careful, I think, when you deal with anything to do with savings and investment, because if you discourage those things, if you prioritise present consumption too much over future consumption, you're basically eating the seed corn that growth depends on.
What do you think should happen with national insurance? I mean, we were in a position with our previous Chancellor, Jeremy Hunt, under the Conservative government, where he was effectively speculating or insinuating that he wanted to get rid of national insurance altogether. What do you think should happen?
Yeah, I mean, so on the one hand, I agree, right? I think national insurance is just a con. It's a trick that politicians use to make it look like we're not paying as much tax on our income as we actually are.
Or we're spending more of that money on our National Health Service rather than other taxes.
Exactly. So most people, I think, naively but completely understandably assume that national insurance is some kind of insurance scheme.
Yes.
Or it's a pension pot.
Yeah.
And I mean, there is still some contributory link. So for making a minimum level of national insurance contributions each year, you get, I can't remember, is it called a national insurance credit or something? And you have to get so many of these annual credits to qualify for different levels of the state pension. But really, that's about as far as the link goes. The money that you pay in national insurance contributions, there is something called the National Insurance Fund, but it's basically an accounting fiction that money just passes through. It doesn't sit there. It isn't invested. It doesn't kind of generate returns and build up a pot for the future. It's money in, money out. Now, by the way, when we were talking about employer pension contributions in the public sector, I mean, there's a great fiction here as well, especially with the sort of civil service stuff, which isn't funded. The Treasury gives money to the government departments to pay their wages and to pay the taxes on those wages and to make the pension contributions. But the employer pension contributions just go straight back to the Treasury and get spent on other things. Because they're unfunded schemes, there is no pension pot for a lot of public sector pensions. Again, it's one of these fictions. There is so much dishonesty in government accounting. But, I mean, to answer your question more directly, right, I don't like national insurance because of that factor. What's good about national insurance, on the other hand, is that it's a relatively flat tax that only applies to labour income. So it carves out savings and investment and other forms of income. Now, that means it functions a little bit like a consumption tax, which is more pro-growth than an all-encompassing income tax that also hits savings and investment. So if we were just scrapping national insurance, giving up the revenue associated with it, and then lumping all of that onto income tax, overall, I think that would be a marginally anti-growth measure. If it was part of a broader set of reforms where you were just simplifying to have one tax on income, or ideally, in my view, one tax on consumed income that gives full tax relief for savings and investments that people make, and then taxes the proceeds of that investment down the line, that would be a much better way to organise our tax system.
I also think what's interesting about that in itself is that the tax burden is not just about how hot our taxes are, but also how complex the tax system is. Daniel, very quickly, what would you do with national insurance?
I've heard it suggested that part of the issue with reforming national insurance is this conception of it as a sort of this is going to fund my pension. So if you abolish it, my pension will be abolished. I've heard one of the suggestions I have heard, because this has been an idea that's been floating around since at least the 1980s, is that you should just merge it with income tax and rename the whole thing national insurance.
And that's what Jeremy Hunt did suggest, effectively, right?
And that gets you around the issue with the perception of it. But I think a lot of the issues that Tom has brought up are fair ones, in that if you do tax sort of investment income as exactly the same as sort of earned income, you may get sort of distortions that you don't otherwise want.
I mean, one other suggestion here, we could just have a contributory welfare system. That wouldn't be the worst thing in the world. Actually, I think that systems that work on the basis of contribution, like many European models, have some appealing aspects that make them superior to what we have in the UK. What we shouldn't have is a make-believe contributory system that just tricks people into paying more tax and being happy about it.
Yeah, I mean, the problem is that the pensioners today have been told that if they pay national insurance and do the right thing their entire lives, that they'll end up with the now triple locked, quadruple locked pension, which we currently spend almost double the entire budget of the Ministry of Defence on. So quite a lot of money. Let's talk about disposable vapes. This is a topic that I am particularly passionate about, not just because I am a vapor myself, amongst many other things, nicotine-wise. What I think is really, really interesting is, we saw this week, front page of The Sun, the government are going to bring back this idea that we're going to ban disposable vapes. It was introduced as an idea by the Conservative government, and it was going to be as part of the offering that the Tobacco and Vapes Bill would effectively have. Now, there are two primary reasons why I think this is one of the worst government policies I've seen the government announce over the last few weeks. Effectively, the two arguments that are being used are that disposable vapes are targeted to children, and so we must ban them, and that it is bad for the environment. So let's tackle both of them. When it comes to young people, we know that, of course, under 18s are already banned from buying this product. So there is absolutely no basis for legislation that we should be banning a product for everyone because people that are already banned from buying it are somehow managing to get their hands on it. There's also, we've got an element of this we've got to put into context. Youth vaping is so overstated. The scale of youth vaping is overstated. According to ASH, Action on Smoking on Health, there are double the number of 11 to 17-year-olds that drink alcohol regularly than vape regularly, but no one is seriously considering a ban on alcohol for everyone just because some under 18s manage to get their hands on alcohol. Then when it comes to this idea that actually, we're going to be banning something and it's going to take it away, I think that's actually one of the most sort of pernicious arguments here. We know that illegal vapes are already on the market. We import the majority of them from China, and they are increasingly being sold across London market. I saw a video recently where somebody was trying to prove that you could buy these illegal vapes with 5,000 puffs in them, which are currently illegal, and you can buy them very, very easily in any London corner shop. And what this means is that effectively the government say, okay, well, if we're going to ban this, it's going to take it off the market entirely. And that's just not true. And we've seen this happen in countries like Australia, where they have banned vaping altogether, and effectively have criminal gangs forcing and kind of looting many of these smaller corner shops in order to force them to sell their illegal products. So this idea that if we ban something, it's going to take it away is just completely wrong, and also means that we are probably going to get a lot worse criminal activity. We're effectively handing over the disposable vape market to criminals rather than the tax and regulated private sector, and at the same time, and attempting to believe that that's what's going to happen. On the second argument around the environment, I think it's really interesting because it's on this basis that, the plastic use is very bad. They're disposable. We use them once and then throw them away, and also lithium production. Now, according to the only paper I've written for the IEA, a vapid solution so far, with my colleague Dr. Christopher Snowden, there are 1,200 car batteries that would be required to produce all of that lithium in all of the disposable vapes that we use in the entirety of the United Kingdom every year. So 1,200 car batteries. It's quite a few, but there are currently 16.5 million electric cars in the entire world. Now, we're thinking about this from that perspective. If we are to ban disposable vapes on the basis that it requires a lot of lithium production, that's really bad for the environment, we've also then got to ban lots of other things on the basis that it requires lithium production, including electric cars. But again, no one is saying that we should ban electric cars on the basis that it is bad for the environment. Now, just zooming out a little bit here for a second, I'm very, very passionate about the disposable vapes ban. But the reason why I think this is so pernicious is that the UK has, broadly speaking, been quite a world leader on tobacco harm reduction. We know that vaping is more than 95% less harmful than smoking. And what the government is now doing is taking away a much safer and healthier choice from millions of adult smokers. They are making it more difficult to quit smoking. And that's why I think this is one of the worst policies the government could be implementing on lifestyle. Tom and Daniel, what do you both think about this?
It was very well put, Reem. I agree with all of that. I mean, I think there are probably three kind of underlying themes here which you see across government policy making. And I'm not just talking about this government, I'm talking about the last government and governments in general, right? I think one of these big problems that we have is just complete scale insensitivity. So an inability to actually weigh up different kinds of problems against each other and determine how serious is this. And I think you see this in an awful lot of environmental policy. You're talking about plastic, you're talking about lithium. Okay, we'd probably rather avoid that waste and that pollution if we could. But yes, let's look at it in the grand scheme of things. Is this a very significant problem that requires actually quite heavy-handed, quite authoritarian government action to correct? No, I don't think it does. I don't think it comes anywhere near to that sort of threshold. The other one, this happens across public policy as well, unintended consequences. The consequences of a given policy are not necessarily the ones the policymakers intend. Very frequently, the consequences are quite perverse. And so, for example, if you see many more illegal vapes on the market, these are probably, and you don't know for sure, but these are probably going to be less safe, lower quality, and you are funding probably all kinds of other criminal enterprises that surround that endeavour as well. The third thing that I find infuriating about modern politics is just this idea that everything really is kind of a gesture. It's sort of a statement of a value. It's not actually tackling real problems and doing it in a sensible and realistic way. Why did these policies come about? It was basically because politicians wanted something to announce.
Yes.
And they wanted something that would poll well, people who didn't really think about it a great deal, an easy headline. There is no way, if you were properly weighing up different kind of policies and priorities against each other, this would ever rise anywhere near the top of your list of priorities. After all, you're talking about banning a product on the basis that people who are already banned from consuming it are continuing to consume it. This is just silly.
Yeah, I mean, it's also, I think, just a reluctance to face up to the idea of trade-offs in policies, so that everyone agrees it's bad that young people, 15-year-olds are vaping or whatever. Which, okay, everyone agrees. But one of the interesting things over the last sort of 10 years since vapes have become really quite widespread is that so the number of children who've been regularly smoking, as in smoking cigarettes, has absolutely collapsed. So like 10 years ago, say, you had about 8% of secondary school pupils were regular smokers, as in smoked weekly. Now that's down to 1%. Only 1% of secondary school pupils are regular smokers. And that's in part because lots of them have basically, if they want to do something rebellious, they've now transitioned onto, buying vapes. And okay, that's not good. We don't want children to be vaping, but if they out of all the bad things children like, if it's a choice between vaping, regularly getting smashed on white lightning, or cigarettes, vaping is by far the best option.
It's so far the healthiest option.
Yeah, as far as the evidence.
But also, the current law means that it is illegal for under 18s to vape. And so what I think what we need to be talking about here is what these solutions actually are. A, enforce the current law, actually enforce those particular the existing legislation. And B, on the environment issues, there are so many ways that you can encourage recycling. One idea floated in the paper, A Vapid Solution, is a deposit return scheme. We see this actually work quite effectively in some European countries, not with vapes in particular, but with plastic bottles. I remember going to visit my friend when she was at university in Germany, and she had a collection of plastic bottles because she was going to get money back from it by giving them back. So deposit return schemes work, incentives work, encouraging people to recycle in different ways. But fundamentally, the reason why this is bad is because it could potentially cost lives. There are millions of adult smokers, and smoking is one of the worst things that you could do for your body. We all know that. Taking away a safer choice from millions of adults. And by the way, disposable vapes are one of the easiest ways to start to quit smoking. They're much cheaper than the refillable vapes, and they're much easier to use for many people. So I think we've got to remember here that we're talking about public health. Actually, even from a public health perspective, this is a bad idea. Right, enough of disposable vapes. Daniel, let's talk about this National Health Service
different aspect of public health. So Wes Streeting, the new Secretary of State for Health, has announced a consultation on the future of the NHS for ideas in the country for how to reform the healthcare system. And he's announced this, saying that I really believe that the best ideas come not from politicians in Whitehall, but from the country as a whole. Unfortunately, for some reason, this consultation, the responses were immediately publicly available and available on the gov.uk website. And some of them are a bit, a bit debatable about whether they're the best ideas. So you've got proposals which include do away with computers. The NHS should be reformed by not having computers. Others, which are along slightly better idea, perhaps, is that patients ought to be served wine, beer, and whiskey to help boost morale. And another one which says...
I'd quite like to get a glass of wine whilst I'm in hospital. That's a great idea.
Another proposal I saw was mandatory euthanasia for bed blockers. And this being Britain, I'm not entirely sure if that was serious or not.
No, I suspect it was.
Yeah. The NHS God demands blood. But yeah, I mean, I think there's a serious point about this in that. What is the role of consultation in government and in policy making? Because it's often seems to be used by governments either as a sort of crutch. There's a big complicated problem. We don't really know what to do about it, or we do have some ideas of what to do, but they'll be really unpopular. So we'll toss it into the long grass. We'll have a big long consultation, and maybe it'll be someone else's problem in a few years down the road. We're at least looking like we're busy, or possibly worse than that, it's simply a box-ticking exercise. You already know what you're going to do, and you're just sort of giving this sort of fiction of consultation, which just slows things down. And, Labour have come out with some ideas for NHS reform around the margins, some of which seem reasonably sensible. There's this idea of a digital single patient record, so that you can share health records more easily, because a lot of that has been sort of jammed up by GDPR. But beyond that, Wes Streeting has said he's open to serious reform of the NHS, but there's never really much sense of what he actually wants.
Yeah. And I think the hope would be that this is sort of a prelude to it. In a way, I don't mind if this is an exercise in managing public expectations, making people feel that they've been consulted and involved, if it leads to some sort of radical reform, which may or may not have anything to do with the consultation further down the line. And I think to give credit where credit is due, where Streeting came in and sort of announced, the NHS is broken, and we're going to have to fix it. And I think he's sort of right to do that. He's right to put it in those stark terms. And he's right, if indeed he is doing this, to think radically about it. I do worry, whether it's the case here or not, that more broadly, one of the failure modes of left-wing politics or centre-left politics is this belief that just if people participated more, if we could have a bit more participatory democracy, well, everything would be fine. And it's this idea that we just need more voice in the system.
Citizens' assemblies.
If people could be heard, then, of course, things would work better. I think that's total nonsense, to be honest with you. The distinction to draw is voice versus choice. Choice, exercised in a free market, is a much more effective regulator of anything's performance than the ability to have your views heard by the people in control. We all know that doesn't really work. And I think one of the issues here, actually, one of the reasons that I'm not convinced that widespread public consultation about the health service is likely to yield anything particularly useful is because, well, first of all, I think a lot of what you need in healthcare is kind of counterintuitive. It's just not what people would naturally assume. So a lot of people, including politicians, will say things like, well, we just need to make sure we focus resources on the front line.
Yeah.
And of course, that's true to a certain extent. We know the public sector is just chock-a-block with bureaucracy. A lot of the private sector is as well, and that can be wasteful. Undoubtedly, there's waste in the system. On the other hand, the way that this is normally interpreted in policy terms is to say, well, we don't need effective management. The doctors can just run the thing themselves. Actually, healthcare is an extraordinarily complex and difficult business. The fact that you're good at treating patients does not mean you're good at running a hospital or anything else for that matter.
Well, I think the point
different
is
skill
we
sets.
wouldn't know what they look like, right? In a social health insurance model, for example, we wouldn't know what those models would look like, but you can't just do away with every single middle manager. I hear that all the time.
Yeah, well, if anything, probably the NHS could do with a few more managers at the moment and a few more or a few more competent.
I mean, this is a good example, right? Because you mentioned the guy said, or woman, saying we should get rid of computers. I assume that meant just within the health service, not the country at large. I mean, who knows? It could be either.
When you consult the British public, you know.
But I think we got so burned on the kind of the famous failure of the NHS supercomputer project and so much money wasted and nothing ever worked, that there has been this real reticence to spend any kind of money at all on IT in healthcare. But actually, IT, properly implemented, can have a huge impact on the efficiency of healthcare and the patient experience. And most other countries around the world with healthcare systems that work better than our one does spend more on IT. They spend more on good, effective management. In fact, they invest a lot more in the capital that goes behind healthcare than we do. And so, again, that sort of lazy assumption, just focus resources on the front line, I think you're likely to hear a lot of that in the consultation, and it points in the wrong direction. But more than that, actually, what British healthcare needs to work more effectively, it's sort of technical, it's structural reform. I mean, basically, there are no price signals in the NHS. That makes it impossible to allocate resources efficiently and work out what the appropriate trade-offs are. The NHS, because it's kind of run top-down and it's government organised, it doesn't have the capacity for bottom-up adaptation, evolution, and kind of learning as it goes so that it can constantly improve in the way that you would expect anything that is subject to a market process to improve. Now, this doesn't necessarily mean we have to just go 100% pure free market tomorrow or there's no point doing anything at all. I'm not trying to argue that, and indeed our colleague Christian's recent work on healthcare shows how you can kind of iteratively move from where we are now, which is a quite government-dominated healthcare system, to a much more kind of mixed economy model, like the European countries have social insurance.
The Netherlands or Germany.
Exactly. And that's all very valuable, and that's kind of the direction I would hope the Labour government might head in. I think if you talk about healthcare reform as marketisation or privatisation, or even denationalisation, that's language that works for us. It's not going to work for a Labour government. It's probably not going to work for the public at large. Perhaps if they talk about it more as like we're socialising healthcare in Britain or we're Europeanising our healthcare system, maybe that doesn't go as well now as it would have 20 years ago. But there are different ways to approach this issue, I think.
There are definitely different ways to communicate that kind of radical national health service reform that you're talking about, Tom. I'm a little bit less sympathetic than you to Wes Streeting. I think you're right. He used the correct language. He said things like the National Health Service is broken immediately after the general election. But so far, we have not seen any of that. And actually, what we have seen is him sort of effectively pandering to some of these public reports, like the Lord Darley report, where he said that he completely agreed with it. And in the report, to me, there was nothing radical in it, effectively saying, yes, the NHS is broken, but we must keep the NHS the way it is. There is absolutely no appetite in the public sector, or indeed within politicians, to fundamentally reform the National Health Service to the point that it needs. On your point, yeah, go on.
Well, I'm not saying it's all going to go well, right? But I also think it's too early to condemn that much. The government hasn't even done its first budget yet. And I think often...
Even within the existing system, there are things you can do to improve improve efficiency. One of, as you brought up, one of the issues is that previous governments have been just throwing more and more frontline staff into a system that can't really cope with it. So we now have about 20% more nurses and doctors than we did in 2019. And yet they're performing, I think, about the same number of operations, that kind of thing.
And on with a story today, actually, about the fact that I think it's 15,000 operations a week are now done by the private sector on behalf of the NHS. So there are some ways that the government are utilising the private sector to improve efficiencies in the National Health Service. But I suppose on fundamental and meaningful reform, we'll have to wait and see. Tom, Daniel, thank you very, very much for joining me today, and thank you to all of you for watching and listening.